So how much of a threat is the deadly virus right here in Utah? Joining us to talk about that is Dr. Brandon Webb from Intermountain Medical Center. Dr. Webb, thanks for being here today.
Thanks for having me.
Well, it seems like this was a very small story that was happening in West Africa. Now we have the first confirmed case in the U.S., in Dallas. There seems to be a bit of a panic, a scare that's going on right now. What would be your message to people who are reading, watching, listening to all of these stories that are getting worried?
As a healthcare provider, the best message that I can get out there is awareness about the actual transmission of this virus. So the first thing that I would want people to understand is that patients with Ebola virus are only contagious once they have symptoms. And the second thing is that the Ebola virus is only spread through direct contact with infected body fluids. So sharing airspace with someone with the virus is not known to be a risk factor for transmitting or acquiring the virus.
Well, when we talk about that one man from Dallas that we all know is a confirmed case, he was on the plane, right, with hundreds of other people, walked through the airport. Those people are not necessarily at risk right now.
As far as we know, because he didn't have symptoms at the time of his travel, their risk is quite low.
Well, at what point should people pay a little bit more attention to this? Because we talk about not panicking, right, not being afraid, but what's that healthy balance?
So this is a good opportunity for all of us to become aware of both the global landscape and also personal hygiene and the things we can do to prevent all types of infections. A lot of viral infections are spread in an identical fashion to Ebola, including the common cold. So hand washing, staying home when you're ill, and keeping others who are home ill and healthy is a key for preventing and recovering from all viral infections.
I know you remember all of the talk about the H1N1 and swine flu, what we called it before H1N1. Is this just something that will go away? Eventually we'll get a hold of this and it won't be an issue anymore?
With many healthcare workers that are working on this outbreak, that's a tragedy in West Africa, and we hope that the outbreak is curbed soon. But from a United States perspective, we are very well prepared to deal with and contain any possible outbreak.
Got it. Well, Dr. Webb, thank you for talking with us. That was a very calm and relaxing delivery. I'm not as afraid as I was before our interview, so thanks for being here.
My pleasure.
And stay with us here on ABC4 Utah News for continuing our coverage of the Ebola virus and its possible impact right here in Utah. We'll have any updates both on air and online at goodforutah.com. Brian, back to you.